My name is Alice Cancer. I'm a PhD student at Università Cattolica of Milan, and my presentation is about a computer-assisted intervention program for dyslexia, which is called Rhythmic Reading Training. Okay, just a brief introduction. Developmental dyslexia is a specific learning disability which has a neurobiological origin. And so it consists in an impairment in the ability of reading, which is present in spite of normal education, in spite of intellectual functioning and socio-cultural opportunities. It's one of the most common neuropsychological disorder affecting children. And so in Italy, the prevalence ranges from 1.5 to 5% of the population. It's quite lower than English-speaking countries because of the transparency of Italian orthography. And dyslexia has some relevant consequences on both learning and scholastic achievements of students with dyslexia, and also causes often a decrease of the motivation for learning and often low self-esteem and self-efficacy of students who have this disorder. Okay, so the primary deficit underlying dyslexia is widely assumed to be a specific dysfunction in the phonological processing. In fact, children with dyslexia are typically poor in basic auditory, perceptual, and timing skills, and many studies reported some difficulties in particular in rapidly changing auditory information processing. And so these impaired auditory processing contributes to the development of an impaired phonological representation for word, which is a distinctive feature of dyslexia. And so in the Italian context, there are two treatments which are the most effective for improving reading abilities of children with dyslexia, which are the sublexical treatment and the visual hemispheric specific stimulation, both of them are aiming at improving the automatic decoding of sublexical stimuli and lexical stimuli. But both of them have some weaknesses in the rehabilitation application, which are, first of all, they require to be to a clinical setting, and also the presence of a therapist who is expert in the methodology. And so they are quite time consuming, and they required an economic commitment of the patient's family. And also the characteristics of the therapist are quite relevant for the effectiveness of the treatment, and so it is not possible to ensure a standardized procedure. And also the outcomes are quite variable. And moreover, since they are stressing like the reading, decoding, and they include some very intensive and repetitive reading exercise, these treatments are often experienced by children with dyslexia as quite tiring and boring, and so these causes often a motivation decrease. Okay, so these concerns pointing out the need for a rehabilitation methodology that could provide, first of all, a supervised usage at home, so it is not required the physical presence of a therapist for each session. Also, a standardized procedure adapting to the specific needs and reading level of children with dyslexia. Also, an invariance of the effects in spite of therapist expertise. And also an engagement and motivation of the participants throughout the whole period of the intervention. And so the use of information technology could help overcoming these weaknesses of traditional intervention methods. For example, it could provide some benefits like the multimodal presentation of stimuli, which can so be delivered both as auditory and visual. Okay, so concerning the motivation issue, we thought about using music as a rehabilitation tool. Of course, active engagement with music provides an enjoyable environment and consequently an improvement of motivation and self-efficacy for children with dyslexia. And second, many studies hypothesize that a training of auditory perception abilities could then, throughout the music training, could then improve also language processing and reading skills. About how music could specifically improve reading skills, there are many evidences about a significant overlap of the brain regions for the processing of both speech and non-speech sounds, and so it seems that there are shared neuromechanisms supporting the processing of both music and language, and also music expertise has some positive effects on language skills and literacy skills, and in particular the ability to discriminate music attributes predict phonological and reading skills in both normal reading and dyslexic children. And so these findings suggest that the improvement made by music training could transfer to the language domain as well, and consequentially have improvement on reading ability. Okay, so many studies try to evaluate the effectiveness of music education itself for the improvement of reading skills of dyslexic children who are readers, preschoolers, but unfortunately the results find out that music education alone that didn't produce improvement in reading skills that are comparable with the results of traditional intervention methods. So the traditional methods should not be replaced with a music education itself. So we wonder if a more efficient way to take advantage of music could be to put the music training inside a reading training, to combine them so that it would be possible to train simultaneously the shared mechanism between music and language. And so we designed and implemented a computerized training program which combined a sublexical remediation approach with a reading processing training, which is called Rhythmic reading training. Okay, about the software characteristics, the software was developed using Unity as a game engine, and both Windows and Mac versions are available. Of course, it has a child-friendly design, and also to provide a distractors-free environment. The exercises were designed for having a extremely simple and clear setting so that children could focus only on the task presented. And also it has a really easy to use interface, and the menus are really intuitive, so it could be managed by any trainer, even a non-expert one. Okay, concerning the contents of the training program, it is addressed to Italian students with dyslexia aged between 8 and 14 years old. The exercises of the training are characterized by the presence of a rhythmic accompaniment, which has an increasing speed throughout the training program. And there are 3 categories of exercises: syllables, merging, and words and pseudo-words. The tasks consist in the children reading out loud some verbal stimuli that could be like syllables, words, pseudo-words, or phrases, and they have to read them in synchrony with the rhythm presented. So the software allows also to add a visual cue, which consists in highlighting the word or the syllable that is meant to be read, and also provide the possibility for the trainer to set the speed of the stimuli presentation, and for making it easier to set the speed, The velocity is expressed in terms of syllable per second, which is the most common measure used for assessing reading speed in clinical contents. So also the complexity of the verbal stimuli is modulating along with speed modulation, and so this is performed manipulating, for example, visual crowding, or decreasing the font size, or removing the visual cue, or adding some concurrent tasks. For example, children reading the stimuli out loud at the same time have to detect some target stimuli by tapping hands or similar tasks. Okay, here I want to show you just a basic example of what the training does. This is the most simple kind of exercise, which is the child has to read out loud the syllables. The video is not working properly because it was supposed to be like a visual cue highlighting the syllable that is meant to be read, but that's okay anyway. This is another kind of exercise. Again, the visual cue is not visible here, and I'm not sure why. But this is another example of an exercise in which the child is asked to guess pseudo words by merging single syllables indicated by the visual cue. Here's a video, if it's working, I'm not sure, of an actual application of the training. This girl is asked to read out loud some words, and at the same time to detect words from a specific category, for example, colors or musical instruments.
Colori.
I'm sorry, I tried this before and it worked, so I'm...
Occhio, uva, caso, maschio, penna, arpa, lima, molla, palma, membra, ramo, muschio, basta, santo, gesso, sole, ombra, turno, palmo, caldo, tratto, basso, saldo, vela, tetti.
So, in order to test the training efficacy on reading skills of dyslexic children, we carried out two preliminary studies, which had test training, retest, experimental design. We assessed reading accuracy and reading speed of dyslexic subjects before and after an intervention period, and in particular, we applied a training intervention into two different settings, a school setting and a rehabilitation setting. The first study was carried out in a school setting, and 28 students aged from 11 to 14 years old were participated in the study. They all were previously diagnosed with dyslexia, and also they attended a junior high school in Lecco. and 2 subgroups of the same size matched for gender, school grade, and level of reading impairment were randomly assigned to either a control group or the intervention condition. And the intervention condition was involved in 9 biweekly sessions of 30 minutes of the training. During the training session, the children were supervised by a trainer. And concerning the control group, they weren't involved in any treatment at all. Okay, so we found out that the rhythmic reading training had some significant effects on reading speed and reading accuracy. So comparing with the control group, who wasn't involved in any treatment, what was assessed before and after a period of the same length, the intervention group improved their reading abilities. In particular, we found some significant interaction effects in long pseudo-words reading speed and short pseudo-words reading speed. And also, it seems that the training boosted also accuracy of reading, and in particular for high-frequency long words and text reading. Okay, the second study was carried out in a clinical setting, and the objective of the study was to test the application of the training in an actual rehabilitation setting and on a particular kind of sample of participants, which were children diagnosed with dyslexia in comorbidity with some other specific learning disabilities, which are quite common to find. And so the patients were 7 students aged between 9 and 11 who were diagnosed with dyslexia and comorbidity with some other specific learning disability, which could be dyscalculia, dysgraphia, or dysorthography. And they were recruited among the patients of the neuropsychiatry unit of the IRCS Dognocchi in Milan. And the experimental design was the same one of the previous study, but unfortunately we weren't able to recruit a control group which was matching with the experimental group, so all of them participated in an intervention condition, and so they have done 20 biweekly sessions of 20 minutes of intervention, and also after that, straight after the training, they were involved in a traditional speech therapy intervention, working only on the other learning domains except reading. Okay. Of course, we didn't have any control group and also a very small sample size, so it wasn't possible to carry out any statistical analysis, but we compared the performances on reading tasks, also other neuropsychological tasks, for example, attention, memory, and we found out some improvements after the intervention period in the mean zeta scores, in particular in pseudo-word speed, text reading speed, and visual sustained attention, and also verbal working memory. Okay, so the results of these 2 preliminary studies suggest that the combination of reading and rhythmic training could be an effective treatment for dyslexia, and that also this intervention, it is possible to apply it into different settings, for example, school setting and clinical settings. And also the characteristic of the software made it possible to implement the intervention also in home settings in a standardized and reliable way. And so, of course, further research is needed for evaluating the effectiveness of the treatment, and it is crucial to study the role of rhythmic component in the reading improvement, and also to compare the effects of the training with traditional remediation treatments, which is what we are doing right now, and also to combine the training with a specific auditory training.